Welcome to Certification in Infection Prevention and Control training sessions presented by APIC South Carolina Palmetto in partnership with South Carolina Department of Public Health. My name is Shay Baville. I'm a nurse and CIC certified and will be presenting session 2 for you. Question 26. Lyme disease is commonly found in all of the following regions of the United States except A. New England, B. Mid-Atlantic, C. Upper Midwest, or D. Southeast. The answer is D. Southeast. Lyme disease is caused by the bacterium Borrelia burgdorferi and is transmitted to humans through the bite of infected black-legged ticks. Typical symptoms include fever, headache, fatigue, and a characteristic skin rash called erythema migrans. If left untreated, infection can spread to joints, the heart, and the nervous system. In the United States, Lyme disease has been reported in all 50 states but occurs most commonly in 3 principal areas: New England and the Mid-Atlantic states, the Upper Midwest with concentrations in the Great Lakes region, and several counties in Northern California. This is a map of the United States showing reported cases of Lyme disease in 2023 from the CDC website. One dot is placed in the county of residence for each reported case. Cases are reported from the infected person's county of residence, where known, not necessarily the place where the person was infected. Since 1995, the range of Lyme disease cases in the United States has expanded significantly. Question 27. All the following organisms can penetrate the intact epithelium of the conjunctiva or cornea except A. Staphylococcus aureus, B. Streptococcus pneumoniae, C. Neisseria meningitidis, or D. Neisseria gonorrhoeae. The answer is A. Staphylococcus aureus. Healthcare-related ocular infections are rare but may lead to catastrophic consequences such as compromised vision and/or blindness. Only a few organisms can penetrate the intact epithelium of the conjunctiva or cornea. Among these are Neisseria gonorrhoeae, Neisseria meningitidis, Streptococcus pneumoniae, Listeria monocytogenes, and Corynebacterium diphtheria. For all the others, a breach in the protective epithelial barrier or mucous membrane must occur. Question 28. A patient is admitted with pruritic lesions on the hands, webs of fingers, wrists, the extensor surfaces of the elbows and knees, and the outer surfaces of the feet, armpits, buttocks, and waist. The most likely diagnosis is A. Scarlet fever, B. Herpes zoster, C. Scabies, or D. Measles. If you recall from session 1, the answer is C. Scabies. These mites are transmitted through direct contact with infested persons. Less frequently, transmission may occur through contact with clothing or bedding, called fomites. Spread of the mite to a different part of the body can occur by manual transfer or scratching. Humans are a natural reservoir for this type of mite. Approximately 2/3 of cases have burrow-type pruritic lesions on the hands, webs or fingers, wrists, extensor surfaces of the elbows and knees, as well as outer surfaces of feet, armpits, buttocks, and waist. Spread can also occur to arms, legs, penis, scrotum, and nipples. Question 29. Which of the following is not likely to contaminate total parenteral nutrition? Mycobacterium fortuitum, Candida albicans, Pseudomonas aeruginosa, or Staphylococcus epidermidis? The answer is A. Mycobacterium fortuitum. With strict adherence to aseptic compounding technique, contamination of TPN solution is rarely the cause of sepsis. However, TPN can foster microbacterial growth. Organisms that have been reported to proliferate in TPN include fungi, gram-positive bacteria, and gram-negative bacteria. Candida is one of the most frequently reported organisms. Question 30. A urine specimen collected from an indwelling urinary catheter was sent to the laboratory for culture and sensitivity testing. Culture results reported a colony count of 50,000 CFU per milliliter of Escherichia coli. Sensitivity testing reported resistance to cephalosporin and sensitivity to ciprofloxacin. This organism is an example of A. Methicillin resistance, B. Aminoglycoside resistance, C. Extended spectrum beta-lactam or ESBL resistance, or D. Quinolone resistance. The answer is C, extended spectrum beta-lactam or ESBL resistance. ESBLs are beta-lactamases found in common gram-negative bacteria such as E. coli and Klebsiella pneumoniae, which confer resistance to all beta-lactam drugs except carbapenems. Klebsiella species and E. coli are the most common ESBL-producing pathogens. ESBLs are enzymes that mediate resistance to extended spectrum cephalosporins and monobactams, but do not affect cephamycins or carbapenems. The presence of an ESBL producing organism in clinical infection can result in treatment failure if one of the above classes of drugs is used. ESBLs can be difficult to detect because they have different levels of activity against various cephalosporins. Question 31. A patient has a nasal swab positive for methicillin-resistant Staphylococcus aureus, or MRSA, in the absence of symptoms. This is an example of A. Normal flora, B. Colonization, C. Asymptomatic infection, or D. Symptomatic infection. The answer is B. Colonization. Colonization is the presence of microorganisms on skin or mucous membranes in open wounds or in excretions or secretions in the absence of adverse clinical signs or symptoms. Question 32. Which of the following is not a mechanical barrier to infection? A. Intact skin, B. Mucous membranes, C. Secretions, or D. Cilia. The answer is C, secretions. Mechanical barriers include skin, mucous membranes, and tears. The skin forms a physical barrier that is very impermeable to most infectious agents. Movement due to cilia or peristalsis helps to keep air passages and the GI tract free from microorganisms. The trapping effect of mucus that lines the respiratory and GI tract help protect the lungs and digestive system from infection. Chemical factors include fatty acids and sweat that inhibit the growth of bacteria. Lysozyme and phospholipase, found in tears, saliva, and nasal secretions, can break down the cell wall of the bacteria and destabilize bacterial membranes. The low pH of sweat and gastric secretions prevent growth of bacteria as well. Number 33. Patients with cell-mediated immunity dysfunction are susceptible to infections attributed to pathogenic intracellular bacteria. Examples of these organisms include Salmonella typhi, Bacteroides fragilis, Listeria monocytogenes, or Staphylococcus aureus. The answer is B, Salmonella typhi and Listeria monocytogenes. As a host becomes progressively more immunocompromised, progressively more virulent organisms can become pathogenic. Thus, patients with major immune defects are subject to a larger number and greater variety of infectious diseases. The most common opportunistic bacterial infections associated with cell-mediated immunity dysfunction are primarily intracellular pathogens that include the following. Question 34. What is the name for a substance that prevents water-soluble elements such as antibiotics and disinfectants from reaching pathogens? A. Cell wall, B. Biofilm, C. Sludge, or D. Biocarbon. The answer is B. Biofilm. A biofilm is any group of microorganisms in which cells stick to each other on a surface. These adherent cells are frequently embedded with a self-produced matrix of extracellular polymeric substance. Biofilm extracellular substance, which is also referred to as slime, is a polymeric conglomeration generally composed of extracellular DNA, proteins, and polysaccharides. Biofilms may form on living or non-living surfaces and can be prevalent in nature, industrial, and hospital settings. So this is a really good representation of the biofilm cycle. Biofilm formation is a continuous cycle that begins when free-floating microorganisms attach to a surface. The microorganisms multiply and produce a protective matrix, creating a mature biofilm that shields them from antibiotics, disinfectants, and the immune system. Portions of the biofilm can then detach and spread, allowing microorganisms to colonize new surfaces and restart the cycle. Question 35. A gram-negative bacterium that is responsible for chronic antral gastritis and is a major factor in peptic ulcer disease is A. Streptococcus pyogenes, B. Salmonella typhi, C. Clostridium difficile, or D. Helicobacter pylori. The answer is D, Helicobacter pylori. H. pylori is a gram-negative bacterium that causes chronic gastritis in humans. This bacterium is also considered to be a common cause of ulcers worldwide. As many as 90% of people with ulcers have detectable H. pylori. It has also been linked to the development of duodenal ulcers and stomach cancer. However, more than 80% of individuals infected with the bacterium are asymptomatic, and it has been postulated that it may play an important role in the natural stomach ecology. H. pylori is a bacterium that can colonize the stomach lining and is one of the leading causes of peptic ulcer disease. The organism damages the stomach's protective barrier, leading to inflammation and the development of painful ulcers in the stomach or upper small intestine. From an infection prevention perspective, early identification and appropriate treatment are essential to reducing complications such as gastrointestinal bleeding, chronic gastritis, and recurrent ulcers. Promoting hand hygiene, safe food and water practices, and adherence to prescribed antibiotic therapy can limit transmission and improve patient outcomes. Question 36. The spirochete Borrelia burgdorferi is the agent responsible for A. Legionnaire's disease, B. Lyme disease, C. Aseptic meningitis, or D. Syphilis. The answer is B, Lyme disease. Lyme disease is caused by the bacterium Borrelia burgdorferi and is transmitted to humans through the bite of infected black-legged ticks. Typical symptoms include fever, headache, fatigue, and characteristic rash called erythema migrans. If left untreated, infection can spread to the joints, the heart, and the nervous system. Lyme disease is diagnosed based on symptoms, physical findings, and the possibility of exposure to infected ticks. Laboratory testing is helpful if used correctly and performed with validated methods. Most cases of Lyme disease can be treated successfully with a few weeks of antibiotics. Steps to prevent Lyme disease include insect repellent, removing ticks promptly, applying pesticides, and reducing tick habitat. Lyme disease, or borreliosis, is caused by the bacterium Borrelia burgdorferi and is transmitted to humans through the bite of an infected black-legged deer tick, as seen above. It is the most common tick-borne infectious disease in the United States. Early symptoms may include a bullseye-shaped rash, as seen above, fever, fatigue, headache, and muscle aches. Prompt tick removal and early treatment with antibiotics can help prevent serious complications. Question 37. Higher morbidity rates in chronic hepatitis B virus or HBV carriers are associated with co-infection of which of the following? A. Hepatitis A, B. Hepatitis D, C. Hepatitis C, or D. Hepatitis E. The answer is B, hepatitis D. Hepatitis D, also known as delta hepatitis, is a serious liver disease caused by infection with hepatitis D virus, which is an RNA virus structurally unrelated to hepatitis A, B, or C viruses. Hepatitis D, which can be acute or chronic, is uncommon in the United States. HDV is an incomplete virus that requires the helper function of HBV to replicate and only occurs in people who are infected with hepatitis B virus. Hepatitis D virus is transmitted through percutaneous or mucosal contact with infectious blood and can be acquired either as a co-infection with hepatitis B or as a superinfection in persons with hepatitis B infection. There is no vaccine for hepatitis D, but it can be prevented by hepatitis B vaccination in persons who are not already hepatitis B infected. Question 38. Gram stains classify an organism as gram-positive or gram-negative. The determinant factors for gram stains are cell wall components of A. Peptidoglycans, B. Lipids, C. Polysaccharides, or D. Mycolic acids. The answer is A. Peptidoglycans. The gram stain is the most important and universally used staining technique in the bacteriology laboratory. It is used to distinguish between gram-positive and gram-negative bacteria, which have distinct and consistent differences in their cell walls. Gram-positive bacteria have a thick peptidoglycan cell wall that it does not allow the crystal violet or iodine complex to be removed during the alcohol wash. Under the microscope, gram-positive organisms appear dark violet, purple, or blue. Gram-negative bacteria contain a lipopolysaccharide layer as part of their cell wall. The alcohol wash disrupts this surface layer and the crystal violet or iodine complex is rinsed out of the cell wall. As a result, gram-negative cells are colorless until counterstained with safranin. Under the microscope, gram-negative organisms appear pink or red. One of my favorite labs in microbiology was gram staining. Bacteria that retain the crystal violet stain appear purple, which are gram positive, while bacteria that take up the safranin counterpart appear pink, which are gram negative. This rapid test helps to guide diagnosis and antibiotic treatment decisions. Question 39. An example of an obligate intracellular parasitic bacterium would be an organism responsible for number 1, hepatitis, number 2, Q fever, number 3, malaria, or number 4, epidemic typhus. Choose 2. The answer is B, Q fever and epidemic typhus. Intracellular parasites are parasitic organisms that are capable of growing and reproducing inside the cells of the host. Obligate intracellular parasites cannot reproduce outside of their host cell, meaning that the parasite's reproduction is entirely reliant on intracellular resources. All viruses are obligate intracellular parasites. Obligate intracellular parasite bacteria include chlamydia, rickettsia, coxiella, and certain species of mycobacteria. Question 40. Which one of the following statements is true regarding bacterial spores? A, they are resistant to antibiotics. B, they allow the bacteria to multiply in adverse conditions. C, they are usually formed by gram-negative bacteria. Or D, they can be identified by gram stain. The answer is A. They are resistant to antibiotics. The function of a spore is to permit the cell to survive in favorable conditions such as extremes of temperature or moisture. Spores become dormant at these times. They do not multiply in adverse conditions. Instead, the spore protects the bacteria until favorable conditions occur, at which time the bacteria can begin to multiply. Spores are usually formed by gram-positive bacteria. Question 41. Which organism found in food poisoning causes the most rapid onset of symptoms? A. Salmonella enteritis. B. Shigella sonnei. C. Staphylococcus aureus. Or D. Escherichia coli. The answer is C. Staphylococcus aureus. Eating foods contaminated with toxins produced by S. aureus causes staphylococcal food poisoning. Food workers who carry staphylococcus and are handling food without washing their hands contaminate foods by direct contact. The bacterium can also be found in unpasteurized milk and cheese products. Staphylococcus is salt tolerant and can grow in salty foods like ham. As the bacterium multiplies in food, it produces toxins that can cause food poisoning. Staphylococcal toxins are resistant to heat and cannot be destroyed by cooking. Foods at highest risk of producing toxins from Staphylococcus aureus are those that are made by hand and require no cooking. Some examples of food that have caused staphylococcal food poisoning are sliced meat, puddings, pastries, and sandwiches. Staphylococcal toxins are fast-acting, sometimes causing illness in as little as 30 minutes after eating contaminated foods, but symptoms usually develop between 1 to 6 hours. Patients typically experience several of the following: nausea, retching, vomiting, stomach cramps, and diarrhea. Question 42. The IP is teaching nurses how to assess infection risks in patients. Depletion of what cell type provides the best indication of susceptibility to most bacteria infections? A. Monocyte. B. eosinophil. C. Neutrophil. Or D. Lymphocyte. The answer is C, neutrophil. Neutrophils are the most abundant type of white blood cell and are formed from stem cells in the bone marrow. They are short-lived and highly motile. Neutrophils may be subdivided into segmented neutrophils and banded neutrophils. They form part of the polymorphonuclear cell family together with basophils and eosinophils. Neutropenia is a granulocyte disorder characterized by abnormally low number of neutrophils. Neutrophils usually make up 50 to 70% of circulating white blood cells and serve as the primary defense against infections. There are 5 types of white blood cells. Neutrophils help protect your body from infections by killing bacteria, fungi, and foreign debris. Lymphocytes consist of T cells, natural killer cells, and B cells to protect against viral infections and produce proteins to help your fight infection. Eosinophils identify and destroy parasites, cancer cells, and assist basophils with your allergic response. Basophils produce an allergic response, like coughing, sneezing, or a runny nose. And monocytes defend against infection by cleaning up damaged cells. Question 43. A 14-year-old boy from rural Maryland was seen in the emergency room with fever, fatigue, chills, headache, and a large annular lesion on his left thigh, which the patient described as burning and itching. What is the most probable vector in this child's illness? A. Tick, B. Mosquito, C. Flea, or D. Louse? The answer is A. Tick. This child's symptoms are consistent with Lyme disease. Typical symptoms include fever, headache, fatigue, and a characteristic skin rash called erythema migrans. If left untreated, infection can spread to joints, the heart, and the nervous system. Lyme disease is diagnosed based on symptoms, physical findings, and the possibility of exposure to infected ticks. Laboratory testing is helpful if used correctly and performed with validated methods. The black-legged tick, commonly known as a deer tick, can transmit the organism responsible for anaplasmosis, babesiosis, and Lyme disease. This tick is widely distributed in the northeastern United States. This is a good image to show the stages of the black-legged tick or deer tick, from its larva form to its nymph form to an adult male versus adult female. Question 44. Which immune marker represents past exposure to disease? A. IgG, B. IgE, C. IgM, or D. IgA? The answer is A. IgG. IgG is the major circulating and extravascular antibody. IgG is the late occurring immunoglobulin in an immune response and is the longest lived. IgG represents past exposure to disease. Question 45. The emergency department reports 3 cases of cramping, abdominal pain, and diarrhea within a 24-hour period. All persons are from the same community, and the same onset of symptoms was within 12 to 36 hours of a picnic they all attended. The IP suspects which of the following foodborne illness? A. Salmonella, B. Hepatitis A, C. Staphylococcus aureus, or D. Clostridium perfringens? The answer is A. Salmonella. Most persons infected with salmonella develop diarrhea, fever, and abdominal cramps 12 to 72 hours after infection. The illness usually lasts 4 to 7 days, and most persons recover without treatment. However, in some persons, the diarrhea may be so severe that the patient needs to be hospitalized. In these patients, the salmonella infection may spread from the intestines to the bloodstream and to other body sites, possibly resulting in death if the person is not treated promptly with antibiotics. Infants, elderly persons, and those with impaired immune systems are more likely to have a severe illness from salmonella. Here's an image of Salmonella enterica, which have flagella, which are powerful multi-protein motors that propel the bacteria forward. Question 46. When reviewing the gram stain of a person with a wound infection, the IP sees gram-positive organisms in clusters. Which organism would this most likely represent? A. Streptococcus, B. Enterococcus, C. Corynebacterium, or D. Staphylococcus? The answer is D. Staphylococcus. Staphylococcus is a genus of gram-positive bacteria. Under the microscope, they appear round, also known as cocci, and form in grape-like clusters. Staphylococcus includes at least 40 species. Of these, 9 have 2 subspecies and 1 has 3 subspecies. Most are harmless and reside normally on the skin and mucous membranes of humans and other organisms. Found worldwide, they are a small component of soil microbial flora. Because they are gram-positive, after their gram stain, when seen under a microscope, they appear purple. They are sphere-shaped cells that characteristically cluster together like a bunch of grapes. Question 47. The IP receives a call from a young man who thinks he is exposed to HIV. He has just taken his first test, an enzyme-linked immunoabsorbent assay, or ELISA, which was negative. Which of the following is most likely time frame after exposure in which HIV antibodies would be measurable in a blood test? A. 6 months, B. 1 to 3 months, C. 12 months, or D. 7 days? The answer is B, 1 to 3 months. People usually develop measurable levels of HIV antibodies within 30 days of infection, though some may take longer, up to 3 months in some cases. Before this happens, there is a period when antibody levels are too low to be reliably detected. This is called the window period. It is during this time that an infected person can pass HIV to others, but still have a negative result if given an antibody test. Question 48. The causative organism of Creutzfeldt-Jakob disease is A. helminth, B. diphtheroid, C. spirochete, or D. prion. The answer is D. prion. Prion diseases, or transmissible spongiform encephalopathies, are a family of rare progressive neurodegenerative disorders that affect both humans and animals. They are distinguished by long incubation periods, characteristic spongiform changes associated with neurological loss, and a failure to induce inflammatory response. The causative agents of TSEs are believed to be prions. The term prions refers to abnormal pathogenic agents that are transmissible and able to induce abnormal folding of specific normal cellular proteins called prion proteins that are found abundantly in the brain. The function of these normal prion proteins are still not completely understood. The abnormal folding of the prion proteins lead to brain damage and the characteristic signs and symptoms of the disease. Prion diseases are usually rapidly progressive and always fatal. Question 49. Anaerobic cultures should be used for any of the following sites except A. Blood, B. Transtracheal aspirate, C. Spinal fluid, or D. Sputum. The answer is D. Sputum. An anaerobic bacteria culture is a method used to grow anaerobes from a clinical specimen. Anaerobes are commonly found on mucous membranes and other sites such as the vagina or oral cavity. Therefore, specimens likely to be contaminated with these organisms should not be submitted for culture. Specimens that are not suitable for anaerobic culture include sputum, rectal swab, nasal or throat swab, urethral swab, or voided urine. And our final question for session 2, question 50. Routine microbiologic sampling is indicated for which of the following? A. Respiratory therapy equipment, B. Dialysis fluid, C. Sterile disposable equipment, or D. Operating room surfaces. The answer is B. Dialysis fluid. Microbiological environmental testing is not generally recommended. Environmental culturing can be costly and may require special laboratory procedures. Additionally, in most cases, no standards for comparison exist. Because of the lack of standards, environmental testing may generate inconclusive data that could result in the implementation of unnecessary procedures or treatments. Routine microbiologic sampling for quality assurance purposes should be limited to biologic monitoring of sterilization processes, monthly cultures and endotoxin testing of water and dialysate and hemodialysis units, and 3, short-term evaluation of the impact of infection prevention measures or changes in infection prevention protocols. Water treatment system testing for dialysis should be performed monthly. The maximum level of bacteria should not exceed 200 CFU, and the maximum level of endotoxin must not exceed 2 endotoxin units per milliliter. This concludes session 2. Thank you again for participating in the Certification and Infection Prevention and Control training sessions presented by APIC South Carolina Palmetto in partnership with South Carolina Department of Public Health.